Hi, I'm Alicia Marie C. Galang. I'm a student nurse and this is my assistant. And today we're going to do bed bathing. This is soap, a shampoo, and a towel for the wet. And this is the pat dry. And this is going to be the drape.
Do proper hand washing. Identify the client and explain the procedure. Provide privacy. With the client in a comfortable position at the side of the bed closest to the health worker, loosen the top sheet and replace it with the bath blanket. Remove the client clothing under the bath blanket. Raise the client's head gently and spread bath blanket under the client's head. Wet the washcloth and fold it around hand in a mitten fashion. Using circular or strokes, wash the face using bath towel. Pat and dry. Remove bath blanket from arm farthest from you. Place towel lengthwise under the arm. Wash with soap and water using long firm strokes from distal to proximal. Immerse hands in water for 3 to 5 minutes. Soap and wash hands with washcloth, paying attention to the interdigital spaces. Repeating this procedure on the nearer arm. The assistant nurse is assigned to check the water and replace it if it's necessary. Wash the chest and abdomen. Soap, rinse, and dry, paying attention to the area to the umbilicus and under the breast. Pat dry. Cover the chest and abdomen exposed near leg by folding blanket towards the midline. Flex the leg at the knee and drape other leg and genital area with bath blanket. Wash the leg from distal to proximal end using long, firm strokes, paying attention to the popliteal area. Rinse and pat dry. Place basin lined with towel on bed, raise lower leg and slide basin under lifted foot, soak well. With soap, wash and making sure to bathe between the toes. Repeat the same procedure on the other leg. Assist the client in an eye-lying position. Place the towel lengthwise alongside. Wash, rinse, and dry from neck to buttocks using long, firm strokes. Wear disposable gloves if necessary. Assist the client in a supine position. Cover up areas of the body exposing only the perineum. Assist the client in dressings. Dispose the material used. Hand washing. Document the procedure.
Hi, I'm Jonas Lucianes Cotto, and I'm from Our Lady of Fatima, and I'm performing shampoo.
Introduce yourself and identify the client. Secure a written order from the chart for a bed shampoo. Explain the procedures to the patient. Provide privacy. Perform hand hygiene and only apply gloves if needed. Begin by inspecting the scalp of the patient. Applying pillow and mattress with rubber sheet and place waterproof pad and place on the patient under the shoulder, neck and head position. Patient in a supine with head shoulders at the top edge of the bed. Placing a rubber sheet or waterproof pad under the patient's shoulders, neck, and head can help to protect the bedding and mattress from bodily fluids such as saliva and perspiration. Supine position facilitate drainage away from the face, eyes, head using plastic turf or rubber sheet and under the patient's head, and a wash basin at the end of the turf can help contain any fluid that may be expelled during the procedure. Place rolled towel under the patient's neck and bath towel over the patient's shoulders. This can provide support and comfort. Brush and comb the patient's hair. Obtain warm water. Making sure the water's temperature is tolerable for the patient. Offer patient the option of holding face towel or washcloth over the eyes. Slowly put water over hair until it's completely wet. and applying a small amount of shampoo, pouring water slowly over the hair. Massaging the hair and making sure the scalp is clean. Wash the shampoo off the patient's hair. Dry patient's hair and scalp. Use second towel if first becomes saturated. Remove the supplies and assist the patient to a comfortable and complete styling of hair. Perform hand washing.
Hi, my name is Chris Anzima Mangon. I'm from BSN M11B, and for Fundamentals of Nursing, I'm going to be performing oral hygiene in an unconscious patient.
You will need mouthwash, dental floss, lip balm, toothbrush, toothpaste, 2 cups, one containing water and one for the mouthwash later, and the nemesis or the kidney basin, and a towel for your patient.
Perform hand hygiene. Donning of gloves. Introduce yourself and identify the patient. Bed adjustment to the appropriate height. Put towel across patient's chest. Give client a small sip of water. Apply toothpaste to the toothbrush. Start brushing the patient's teeth with a front to back motion to clean the outside surfaces of the teeth. Then move on to the chewing surfaces of the teeth and clean the inside surfaces and tongue with a front and back motion. Then, lastly, clean the front of the teeth with an up and down motion. Give client a sip of water to rinse. Using an 18-inch dental floss, wrapping the end of the dental floss with both fingers, floss the patient's teeth. After 2 teeth, moving the dental floss. With 1 part of mouthwash with 3 parts of water, allow the client to rinse approximately for 30 seconds before spitting. using the corner of the towel to wipe the patient's mouth. Offer lip balm to the client. Remove the supplies and the towel. Perform hand hygiene. Then adjust the bed. Documentation of the procedure.
Basin, tongue depressor, water, mouthwash, cotton swabs, and extra towel.
Donning of gloves. Introduce yourself and verify the client and explain the procedure. Position the patient into left lateral recumbent. Put the towel beside the patient. Put the basin beside the patient. Use a tongue depressor to depress the tongue. Clean the inside of the patient's cheek, teeth, and tongue using cotton swab with mouthwash solution. Wipe the mouth using cotton swab with water to rinse excess mouthwash solution. Remove the basin, remove the towel. Remove and clean the supplies. Position the patient in a supine position.
Hi, I'm Arby Jackson Enriquez, your student nurse for today. For today, I will do a client positioning para maging comfortable ang ating patient kapag sa mga assessment.
Introduce yourself and verify the client and explain the procedure and ask for consent to touch the patient. Perform hand hygiene. Provide privacy. The first position is a supine position. Positioning the client in the prone position. First, position the client in the low Fowler position. The second Fowler position is the semi-Fowler position. The last and third Fowler position is the high Fowler position. Position the client in a Sims position. Position the client in a lateral position. Position the client in a knee-chest position. Position the client in a lithotomy position. Position the client in a Trendelenburg position. Perform hand hygiene.
Good day, I am Mariana Colbia Anasco, and for today, I will be performing transferring of the patient from the bed to the wheelchair. And first, I'll be performing hand hygiene before the procedure.
Wait.
Introduce yourself to the patient and identify the patient. Explain the procedures to be done and ask for consent to be touched for the procedures. Provide privacy to the patient. Assess the strength of the upper and the lower extremities. Fan-fold the top linens to the foot part of the bed. Slip one arm behind the patient's neck and shoulder and slip another arm over the both of the patient's thigh and near the knees. Support the patient's upper body in the erect position. Watch out for dizziness and signs of fainting. Give the patient a simple command and ask for their participation. Put slippers to the patients to provide base of support or let them put them on to support autonomy. Help the patient to stand. Place shins against patient's shins to lock their feet. Instruct the patient to reach the armrest of the chair by her strong hand. Lower the patient into the wheelchair by bending your hips and knees. Position the patient's feet on footrest, making sure that the patient is comfortable and is in good body alignment. Cover the lap and legs with a blanket. Confirm with the patient for comfort and good body alignment. Document the procedures done. Perform hand washing.
So for today, I'll be performing the back massage. I'm your student nurse, Mariana Amalia, from Our Lady of Fatima University. For the materials, we have the alcohol, the analgesic, the lotion, towel, and the drink.
Perform hand hygiene. And provide privacy for the client. Introduce yourself and identify the client. Assess your patient's pain or discomfort by asking them on a scale of 1 to 10 how much they are experiencing discomfort, 10 being the worst. Offer analgesic to the client before performing the back massage. Adjust the bed to a comfortable position. Lower the side rails of the bed. Help the client find a comfortable position. If the patient has trouble breathing, help the patient lie on the side of the bed with the top of the bed elevated. Make sure and ask the patient if the patient is comfortable. Ask the patient if he's allergic to the lotion you're using. Assess the skin and only apply gloves if necessary. Warm the lotion in your hands. Plan to do a variety of strokes depending on what kind of pain your patient has. Effleurage technique is a gliding stroke used for up and down stroke and back again. This motion does not manipulate deep muscles, but it smoothens, extends muscles, increases nutrient absorption, improves lymphatic drainage, and venous circulation. Petrissage or muscle kneading stroke relaxes tense muscles, stimulates local circulation. Friction or strong circular stroke brings blood to skin surface, increases local circulation, looses tight muscle groups. As you're massaging the patient, encourage the patient to have deep breath and relax. Keeping the hands in the continuous motion into the skin. Begin with circular motion, massaging the sacral area. Begin by massaging from buttocks to the shoulders. Use firm and smooth massage while massaging the scapula area. Continue with the upper arms and laterally the sides of the back down to the iliac crest. Continue the massage pattern for 3 minutes. Continue with the effleurage massage to the base of the spine to the neck. Then circular motion to the base of the buttocks to the neck. Knead the muscle of the back between your thumb and forefingers. Use both of the hands to knead the one side of the back. Then move up the other side. End the massage with long strokes of effleurage motion and tell your patient you're finished. Wipe the excess lotion with a bath towel. Remind the patient to inhale deeply and exhale gently. Caution the patient to move gently after resting for a few minutes. Trust the patient. After allowing the patient to rest for a few minutes, remove the bath towel. Assist the patient when returning to the position and return the bed adjustment made to the low position. Evaluate the patient's pain level and provide any kind of comfort necessary. Perform hand hygiene. Document the procedure done.